Here we go. This also falls into the category why scientists, nutrition scientists, talk about sports nutrition is the new healthy aging. So things that we do for athletes, everyone should do if they want to remain independent their whole life. So really, beyond the multivitamin mineral, because, obviously we have to have that or nothing really works anyway. So we got to make sure we have that and we have our levels all the way up. So that also works to protect the joint, because every system, our whole skeletal system, all our systems are vitamin mineral dependent. But there's some ingredients that we can actually add to the body as the body doesn't get them do a very good job by itself anymore, whether it be aging or injury related, and that's JointFlex. So we'll kind of cover all that. All right, so here it is right here. This is it. Basically, we use it to support joint activity recovery, because joints break down just like muscles during activity, and discomfort, for someone like me whose knees are all beat up and injured from making a living as an athlete, and then skin protection, and skin health. Okay, so again, let's just take a look. Let's do a little background. So this will be fun for you, because by doing this background, you can answer questions, because you got the download. Rob sent this to you, so you'll always be able to be that smart guy in the room, right? That's what this kind of stuff does when you get the background. And the stuff I highlighted is really the stuff to remember. This is all part of a class I do. All right, so collagen. What is it, first of all? Basically, it is the primary structural protein in tendon, ligament, cartilage, skin, and bone. So that's the type of protein. So it's a completely different protein than a muscle protein. It has some of the amino acids, most of them in there, but it is an incomplete protein when it lacks tryptophan and cysteine, so you would never use that as a pre-workout. You see collagen proteins out there, people go, should I take that? Well, not for a pre-workout or not for muscle recovery, because it's missing these 2 amino acids. Now, you may have enough of those in your body, so you might get something out of it, but there's no point in that at all. And it's very low on the essential amino acids, which are the only ones that actually trigger muscle protein synthesis. So it's not used for that, right? But it is high in glycine and proline. These amino acids are the ones that are found in collagen protein, which is found in those groups. So there's a little background there. So there are various derivatives now of collagen. So there's peptides, amino acids, bioactives, and so forth. Like ours is a derivative, you'll see in that are commonly used, right? For these purposes, to help with this health here and kind of prolong all those. But there's a problem with it. And the problem is collagen supplements getting into the target tissues. As you take a supplement, you can't just eat a supplement that's got collagen, it's going to go to your skin or it's going to go to your joint, right? It doesn't work that way. Most of it's going to get broken down and digested and metabolized in other areas. Bodies puts it together as different proteins. So that's the problem. Everyone knows that, right? And besides that, let's say we could get it there. It's not necessarily the collagen building materials that are in short supply. We got plenty of those aminos in the body. It's the machinery that builds the collagen that really doesn't work well, certainly as we get older, because we're not supposed to be here, and fast enough for complete repair in athletes. So there's the issue. However, the solution to all those issues has been very elusive, but let me tell you something, there is no shortage of research around it and no shortage of products on the market. They're extremely popular, and that's because of aging and skin health, all these different things that happen now, right? So there's been a nonstop research around these things, what we're trying to find, what we're all trying to do are the ingredients, including special forms and a synergistic array of these things, so proper ratios and size that can reach the target tissues in what we want, the molecules we want there to help it in sufficient quantities, support the synthesis to make recovery happen faster, and of course reduce discomfort. And there's, we've been able to find some now, right? So athletes use it for recovery and protection, right? They'll use it to help speed repair, exercise-induced damage. When I say collagenous tissues, just think of connective tissue, right? Your cartilage, in your joints, and all that. And that's also skin. Okay, that's why I'm using that term there, right? So just like muscle, you guys, you've seen this in my prelos before. When you work out, this is what's happening after exercise, hours after exercise. You break down. All your joint is getting broken, all that area from pounding, especially if you do repeated jumps. So athletes like football players, basketball players, they're breaking this stuff down bad. And it takes a long time to repair it to get back to normal. So you can see if you don't repair it, you end up setting yourself up for injury. Yes, go ahead. Okay.
Yes, I'm just gonna.
We're gonna meet everybody.
Yeah, but remember, if you have any questions,
Yeah.
just unmute and you're good to go.
Right, and we'll do the Q&A, as we get down here too. Okay, so people take, amino acids, the collagen proteins and so forth to here to be able to help rebuild it. And again, like we said, this is just the regular breakdown, regular synthesis, and the goal is, and they adapt. So in other words, just like muscles get bigger, well, cartilage can get stronger based on the force that you're applying to it, as long as it gets a chance to repair. So that's why athletes will take it analogous. So the same way they take proteins and essential amino acids for muscle fiber repair before and after your workout, or amino boost before and after, they'll take collagen supplements for the same thing for joint repair, hoping it gets to the joint. And the problem is, as we know, most of them do not. All right. Now, in aging, it's the same goal and rationale, right? To support the decreasing collagen levels that happen with aging, right? And we want to supply the building blocks. So there's no difference. Here's what your cartilage in your knees and your joints do. See, this is really a good picture. It just shows you the collagen proteins up here. It's full of, there's fluids in it here, the hyaluronic acid, which is glucosaminoglycans here, right? These are the make up this part of your cartilage, right? And that's your shock absorber, right? Well, here's what happens. As we get age, these levels that we're looking at right in here, this nice healthy cushion joint, they begin to decrease. Look at this. So in your 20s, you're at your peak. At 30, you're already losing significant. 40. So here, so you can imagine what's happening. Here's what your knees end up, kind of like mine, right? Right here. There's a healthy knee joint here with good all this. But look what happens here. As this wears down, then you get hypertrophy here, and the knees just get bad. And this is why these are the most popular supplements in the world, because this is what people are trying to treat without the drugs. The drugs will end up taking 10 years off your life to kill the pain. And we know that your liver and kidney gives out from filtering it. These are actually healthy, let alone not harmless. All right, so that was the joint side, right? You just got all that. Now look at skin, same thing. This is still going back. Replace the natural collagen losses. That's what the goal is. Okay, the rationale here, same thing. We lose about 1% of collagen per year, right? In our mid-20s, we just saw that diagram, and women lose up to 30% in the first 5 years of menopause. That's on top of what they've already lost, the other 30%. So it goes fast, right? Like they do everything they possibly can for their skin as well. So people are hopeful with collagen supplements. But the bottom line there, again, this is what the younger skin, see all the collagen fragments in here? These ones here, this is what holds up the skin, keeps it nice and subtle and everything else. And then here's what happens, and this is what the wrinkles, when the dermis layer here gives out, because you got less stuff holding it up, less collagen, right? We already saw what that is. And so you end up with that. So this is a nice, healthy collagen structure. Here's one that gets old like mine, okay, as you start to lose it. All right, we're trying to support that all the way around. But the problem is this: unless you're deficient in those amino acids I showed you, which I would argue none of you are, and make up the skin collagen, it's going to do little of anything to reverse age-related decline. It's just, they're not going to, it's just not going to help you in those specific collagen amino acids. When you buy those supplements, nothing's probably going to happen there. But photoaging, this is what people don't realize, and this is a little test for you. Okay, I don't think I'm not just being cute. I'm actually, this is a great analogy. Well, first of all, almost all of the aging on our skin, 90% of aging in human skin is from the sun, ultraviolet rays. So you want to work on what that's causing, right? That's why the superior antioxidant we have is probably the best product in the world you can get for it, because they actually block those ultraviolet rays, from the skin. But the bottom is this. Think about this. If you took a look at like the buttocks of a 75-year-old man or woman and compared that to the skin on a baby, it's almost identical. It is the stuff that's exposed to the ultraviolet light. So in other words, it is treatable, right? And I got a slide at the very end there all the way around, but also what we can do with the joint support. All right, so let's get into the joint support now. That was your little background. That was your little class on collagen. All right, so from all the research, we used to use glucosamine and chondroitin, which were the most popular supplements for joint support for our athletes. When we switched them to this, we knew we hit a home run. So this is the best solution right now, including the clinical trials around this formula right here. And because it is a very unique makeup. So we were able to find, so the These things are actually show up in the same ratio they do in the joint. And then what they do, they micronize it, they shrink them so they can actually get into the body and stay somewhat intact to positively influence that physiology in those areas. That's the difference between this and your collagen amino acid supplements, right? All right, so here it is. I put it up. This is really a summary of the whole thing on one page, so you can actually print this and give it to someone if you needed to. But just a nice way. And then the red stuff is really the stuff to take home messages. But anyway, it's a very low molecular weight. They actually micronize it once it's extracted. And it's extracted from, believe it or not, chicken sternum. It's identical to the ratios of the 3 ingredients that are in our cartilage, right? And it happens to be chicken sternum, right? Some people use fish skin and things like this, but this is the one that's closest. So the collagen peptides, that's what they are, right? And they also have what we call glycosaminoglycans, so we'll call them GAGs, right? And they're derived from this extracellular matrix from the chicken sternum, which is where the cartilage is, right? And it's a naturally occurring matrix of these 3 ingredients. So it's a collagen type 2 peptide, right? Type 2 is what we have in the cartilage. Hyaluronic acid, that brings the water to the joint, and chondroitin sulfate, okay, which helps with the inflammation and so forth. But the bottom line is from a single natural occurring source. That's what the difference is. Everybody else, when they put these kind of things together, they're from different sources. So it's not natural, and the synergy and the ratios are not natural. And that's what we think, that's what what we know obviously allows this thing at least to get active to the joint. So we end up, this allows passage and activity to the target tissues where we want to go, whether it be skin and the joints area. So this is what it looks like. These are the 3 ingredients here, and they're made from sternum cartilage. We were just talking about that. Nature's richest source of these particular ingredients, right? That we would never get them in the body when you extract them, but when you hydrolyze them into smaller molecules, make them small, you end up with this. And this is the exact ratio they are in a human joint. Bingo. So we've actually got something there that makes all the difference in the world. And we use it for what? Maintenance of overall health of joints, connective tissues, including during exercise and aging, right? Joint discomfort, that's what I use it for now. I can't use my knees for anything else as I'm moving, I'm walking around. And athletes use it in joint activity recovery. This is one that you see, like, both my sons are professional athletes, so they use it regularly. And that includes the support for the recovery for the musculoskeletal tissue, or what we call ECM, extracellular matrix, remodeling, because they remodel every day. You're working out when you're running and jumping, whether like one's football, one plays football, and the other one's a fighter. These guys, they need to recover quickly there. So if they have those type of movements, so they use it for that. So we have athletes using it. And then for skin, the dermal connective tissue, just skin connective tissue, right? Skin protection and health. So those are the anti-aging properties of skin. So there it is. It's all really on one slide, what makes it special, right? Again, you have this download. So the goal, obviously, of using it is, you don't find this stuff in your diet, right? So, and of course, to help our skin and joint health. And the ingredients have shown the ability to improve the collagenous tissues to help replenish the age-related losses of the necessary building blocks of connective tissues. So there's that part. And then for the athlete, they also may help recovery from specific activities. When you're severely challenging connective tissues, jumping, fast direction changes, all those things. Because we're trying to reduce the risk of injuries in athletes. And again, these are this is the target tissues we want that to go to. So now we've just supplied the building blocks. All right, and the rationale, we've already kind of talked about it, but the micronized ingredients derived from the cartilage, right? That's what these 3 things here are. Increase the pool of building blocks to be able to repair these things, right? We got them to the site of activity where we want it to be, providing the nutritional replenishment or balance necessary for homeostasis. Homeostasis meaning everything's working properly, right? Synthesis is right, breakdown is right, synthesis, and it comes back to a nice, comfortable place we call homeostasis, right? And again, these are the things that cause it. Joint pain is from the degenerating cartilage that we talked about, and then age, excessive body weight. So this is what we're taking care of right here. We want to maintain this the best we can, rather than ending up like this, and we can prolong that by making sure that they're getting all those things. And again, this is what we do. These BioCell collagen, which is the ingredient in the JointFlex. maintains the bioactives of these three ingredients that are present in here. That's what we're trying to do to improve the function and discomfort through improving the cartilage synthesis and joint lubrication. Look how much water's in here. That's what the hyaluronic acid does. It sucks the water into the area, right? And it provides effective replenishment, that is compromised by excessive activity and injury. So that's what we're trying to do, trying to maintain it by putting in those particular things. And there it is here. So this is identical to what you find in human cartilage right here, in this ratio. So it mirrors the molecular composition of our cartilage. All right, so again, the individual ingredients I put in here, I kind of talked about, you don't need to know anything there. It's just obviously the type 2 collagen is what we're extracting. That's found in our cartilage, and it contains all those things, right? And hyaluronic acid, what it does, it brings water to the cartilage and joint viscosity, so the synovial fluid, you guys kind of heard of that before. And then this actually stimulates, so the chondroitin sulfate actually stimulates synthesis by the chondrocytes in there. So it tricks the body into sort of making more cartilage rather than always breaking it down. And it also controls inflammation that happens in the joint as well. And by the way, all of these things independently have shown some value in clinical trial. Combine them all like this in the right ratio, you got a home run, right? And here's a couple of studies here. Comparing this against glucosamine and chondroitin, that's all we ever used back in the old days. I'm sure, Jacob, you remember, I know you're not that old, but
Yeah, he is.
we used that for years for all our athletes. Comparing the two, you can see the difference here. This is actually a scale of pain. You can take a look at this here. There's significantly better reduction in pain scores with the BioCell collagen. That's very significant. And then here's the latest one. This was just a couple of years ago. Great one here. You take a look at this. This is versus placebo now, right? The collagen group, our BioCell collagen group, right here. Starting here, look at this. That's why things don't happen overnight. I tell people you got to use it for 30 days to get that benefit, that pain reduction. If it doesn't work after 30 or 60 days, it's not going to kill your pain. You might have to go to drugs if it's bad, but it's mild discomfort. This is not like a drug, obviously. In fact, it's healthy all the way around. But you can see this is big right here. Significant decrease. If you've got subjects with a greater than a 30% decrease in pain. That is significant all the way around, needless to say here. And then you've got over here, you've got the improvement in physical activities, 30% increase in improvement in physical activity. So that's very, very telling. So it just tells you how well it actually works. All right, so now let's go to skin health, jump here before we get to the end here. What we're trying to do there is boost the age-related diminishing collagen and the hyaluronic acid, right? That's the stuff that brings the water to maintain skin tone by avoiding that dermal layer collapse that caused the wrinkles, remember that we looked at? So by increasing the pool of these building molecules, special molecules we just showed you, right? It can help maintain the integrity of the extracellular matrix, but right below the dermis, right? So this again, we saw those things. When this breaks down here, you end up with this. This is what it looks like when you magnify it. It's like, it's like the prunes, the shriveled prunes. You've heard that many times, right? Okay, so does it work? Here's the first study. First study showed significant improvement all the way around, not just in dryness and scaling, bring water, but also wrinkles. You can see the significant reduction in wrinkles. So reduction of facial aging signs here. And then these were the final results of that reduction in wrinkles. These are all significant. You can't print this if wasn't a significant amount. Reduction of wrinkles and fine lines, improvement of skin texture, maintenance of integrity of the hyaluronic acid, so the water in the areas, increased collagen content. That's a big one. That means it actually got there. We measured the collagen content in that, and we find there's more than there was at the start of the study. And then increased blood microcirculation. Well, that improves everything, getting the bad stuff out of the body. And here's the latest study just last year. So you can tell, that's why we stay with this company, the BioCell Collagen Company. We stay with them because they continue to do research and continue to prove it all day long. But this is the latest one right here. And this is significant. So you look at age-dependent signs on the face, right? Include elasticity, crow's feet lines, deep, and the depth of wrinkles. But this is big. So you end up here, you got 82% of the women in the treatment group showed improvement in collagen levels. And that is huge because we actually got the collagen to the areas, right? Only 7.3% in the placebo. So that's, needless to say, that's significant. Then if you look at the wrinkles, the difference in the wrinkling and so forth, you've got a definite and the mean improvement here percentage-wise, obviously very, very significant in all this. And again, you see at the time it takes. There was no difference in crow's feet for 6 weeks. Wasn't until the 12th week when you start seeing the doubling in all that. So that's important to know. That it takes that long for it to work, and then hopefully it holds for as long as you're using it. Okay, so let's just summarize the whole thing we talked about. Who's it for? Well, adults, we already know with discomfort or overuse, such as me, and we take anywhere from 2 to 4 a day. As far as the joint goes, this is obviously these are the things we're providing the building blocks for improved joint viscosity to help maintain cartilage. And again, that's because we've got this great patented ingredient that we micronize to get there. It's the right synergy and ratios, proper absorption. So this, again, this is all your summary. And for the skin, enhanced blood flow, reduce facial signs of aging, reduce wrinkles, improve skin tone. And for athletes, the collagenous connective tissue recovery. So these, all those. So I always call it a 2-for-1, right? You got joint and skin, it's getting it all, worked out. And typical use is real simple. This is kind of important if you're working with someone or if using it properly. Obviously, it's anybody that we just talked about, but you also you're working with athletes. These athletes here that really challenge their joints. So you've got the older person here and here, but here's what I was getting to here: 1 capsule in the morning and 1 capsule at night. Now, when I say for optimal results, anytime we're working with athletes that with injuries or they're doing really a lot of work. Jumping with the knees and everything else, then they'll take 2 in the morning and 2 at night. And these people have all the money in the world, so it's not that big a deal. But it won't last long, obviously, at 2 and 2. But it works that much better. No question about that. Okay, I put some notes in here for you guys. Nothing to know. Just, I put these notes in here for those of you, that want to control your skin and photo aging. This is the best things to do. I promised you this slide at the end. Obviously, avoid direct sunlight. That's where it's all coming from, and use sunscreen. And then protect the skin damage from the inside out by consuming a healthy diet, stay active, and maintain a healthy weight. Those are all important. And then proper dietary support from what you're not getting from your food. That will upregulate all the body's systems. What's the largest organ in the body? Who knows? It's the skin, the largest organ in the body. To preserve youthful skin, you need to do this, right? Take your complete vitamin minerals, got all the vitamin C's and E's at the levels the skin loves, right? You see those in skin formulas all the time, right? And then this superior antioxidant has this for you. Lycopene, these are the things that block the ultraviolet rays. That protects our eyes from the sun, and it protects our skin from the sun. They're in there. It also obviously protects athletes and they recover faster, and that's in the superior antioxidant. And make sure you get 1 gram per pound of protein, right? So we have all the necessary amino acids in there we were talking about. And then take the joint support, the collagen and those fragments, the right size ones to get in there. And that will trigger the natural synthesis rather than supplying the amino acids. You've got all that, everything else you need there. So that's it. That's it. That's your little thing there. You can stick that up there and your skin will forever look like you're 25 years old. I just put how to use it here. That's all. Okay, that's it.